Here's something that might surprise you. While most Americans are enjoying their summer barbecues and beach vacations, COVID-19 is quietly making a comeback across the nation. But here's where it gets controversial. Are we adequately prepared for what experts are calling a predictable seasonal surge? The Centers for Disease Control and Prevention just dropped some eye-opening data that has health officials raising their eyebrows. According to their latest Friday update, the country has officially shifted from low to moderate levels of COVID-19 wastewater activity nationwide. Think of wastewater monitoring as our early warning system. It's like having a crystal ball that can spot viral spread before people even realize they're getting sick. And this is the part most people miss. Wastewater surveillance often catches infections weeks before traditional clinical testing does. The CDC explains it this way. Wastewater monitoring can detect viruses spreading from one person to another within a community earlier than clinical testing, and before people who are sick go to their doctor or hospital. In simpler terms, by the time you're feeling symptoms and heading to get tested, the virus has already been circulating and showing up in community wastewater systems. Now, here's where the geographic picture gets interesting and potentially concerning. The western United States is currently experiencing the most intense viral activity, with 5 states leading the charge: Alaska, California, Colorado, Nevada, and Utah. This regional concentration raises fascinating questions about travel patterns, population density, and seasonal behaviors that might be fueling transmission rates. But the scope extends far beyond just the West Coast. The CDC's infection growth estimates paint an even broader picture of concern. As of the most recent Tuesday data, a staggering 45 states are experiencing either confirmed or likely growth in COVID-19 infections. That's a significant jump from just 40 states the previous week, meaning 5 additional states joined the growing list in just 7 days. Here's another metric that's quietly climbing: emergency room visits. While the overall percentage of COVID-related ER visits remains relatively low compared to peak pandemic periods, the week-over-week increase is undeniable. This uptick in emergency care visits often serves as a reliable predictor of where case numbers are headed in the coming weeks. Dr. John LaPook, CBS News chief medical correspondent, recently shared insights that might reshape how we think about COVID seasonal patterns. Speaking on CBS Mornings, he explained what has become the new normal. We now know that there's a winter spike and then there's a summer spike. This dual season pattern represents a significant shift from our initial understanding of the virus during the early pandemic days. But here's the silver lining that often gets overshadowed by rising case numbers. Dr. LaPook emphasized that every year, the number of deaths, the number of hospitalizations is gradually going down each season. This trend suggests that while infections continue to cycle seasonally, our collective immunity through vaccination and previous infections is helping reduce severe outcomes. However, and this is where the controversy might spark some heated discussions, should we be more concerned about these rising numbers? Dr. LaPook cautioned against completely dismissing these increases, particularly when it comes to protecting our most vulnerable community members. Elderly individuals, young children, and immunocompromised people can still experience severe illness, even in this era of generally milder outcomes. This raises some thought-provoking questions that deserve honest conversation. Are we becoming too complacent about COVID surges because they've become predictable? Should businesses, schools, and healthcare facilities be implementing more proactive measures during these known seasonal peaks? And perhaps most controversially, are we adequately protecting those who remain most at risk while the majority of the population experiences milder symptoms? But wastewater data doesn't lie, and neither do the emergency room statistics. As we navigate this latest summer surge, it's worth considering whether our current approach strikes the right balance between returning to normal life and maintaining appropriate vigilance. What's your take on this summer surge? Do you think we're handling it appropriately? Or should communities be taking more aggressive preventive action? Are you seeing signs of increased illness in your area? And how are you personally navigating these rising numbers? The comments section is the perfect place to share your experiences and perspectives, whether you agree or disagree with current public health approaches.